Right. So we're going to go ahead and get started. So first, let me just say thank you so much for everyone that has come out tonight to join us. This is the Xi Alpha Lambda chapter of Alpha Phi Alpha Fraternity Incorporated's ongoing health series, Onward and Upward. And tonight we're going to be dealing with mental health awareness because May is Mental Health Awareness Month. So again, thank you very much for joining us. I am Brother Dr. Benjamin Young. I'm going to be your host and moderator tonight. And I am also the Health Awareness Chair for our chapter. And it gives me great pleasure to introduce you to the panelists who are going to be enlightening us tonight. So without further ado, I'm going to go ahead and introduce them. So let's start off first with Dr. Adrienne Weaver. Just to give you a little bit of information about her, Dr. Weaver is a trauma trained clinician, licensed clinical social worker, professor, consultant, and speaker. She specializes in trauma, anxiety, relationships, identity development, and culturally responsive care for children, adults, and couples and families. Her research focuses on Black women's experiences, trauma, leadership, and campus sexual assault policies at HBCUs. She is also the founder of Changing the Narrative Consulting, where she supports organizations and leaders in creating trauma informed and empathic environments. Dr. Weaver is also a proud member of Delta Sigma Theta Sorority Incorporated. Thank you, Dr. Weaver, very much for joining us tonight. We appreciate your presence. And then next, we have Mr. Maurice Spence. Mr. Maurice Spence is a registered nurse with over 14 years of experience in hospitals in Florida, North Carolina, and Tennessee, and in a variety of nursing roles. Pertinent to tonight's talk, he served as a house supervisor at an 80-bed acute inpatient mental health facility and currently works at an inpatient psychiatric hospital in North Carolina, which focuses on active duty military, veterans, and first responders who are experiencing psychiatric challenges. He is a proud member of Alpha Phi Alpha Fraternity Incorporated. So thank you so very much, Brother Spence, for being here tonight. We appreciate your presence. Oops. And then next we have Miss Demetra Chandler. She is a licensed clinical social worker, clinical supervisor, substance abuse specialist, and behavioral health leader, currently serving as the clinical director of substance abuse treatment in a substance abuse treatment facility in Fairfax, Virginia. She has extensive experience working in medical social work, community services boards, military and veteran populations, children and families, crisis intervention, and community mental health settings. Her clinical background includes working with trauma, anxiety, depression, eating disorders, behavioral disorders, suicide prevention, crisis management, and co occurring mental health and substance use disorders. In addition to her clinical leadership, she has owned and operated two private practices and founded a nonprofit organization focused on mentoring and developing young Black clinicians while providing free mental health resources to underserved and marginalized communities. Thank you so very much, Ms. Chandler, for joining us tonight. We appreciate your presence. And then lastly, but certainly not least, we have Mr. Watson Louisdor. He is a licensed professional and mental health counselor. He owns A Better Tomorrow Counseling and Consulting LLC and has worked at the county, state, and federal level in mental health. His area of specialty is mental health and substance abuse. He also recently launched a YouTube channel called Watz, the Black Therapist. And it's Watts, W-A-T-Z, short for Watson, his name. But again, Watts, the Black Therapist, and it can actually be found on Instagram, TikTok, and Facebook under the same handle. He is also a proud member of Alpha Phi Alpha Fraternity Incorporated. So, Brother Louis Dor, thank you so very much for joining us tonight. We appreciate your presence as well. And now I just want to establish a few ground rules of how we hope to be able to conduct things tonight. As far as the forum is concerned, it's really going to be Ask the Expert. So you will have a chance to ask questions that you may have of any of our experts, general questions or specific questions based on some of their areas of specialty. And because we realize that sometimes conversation needs to be stimulated a little bit, I have actually had them submit some questions to me, kind of vetted on their own experience, that I will be using as well to kind of get the conversation going. But we will certainly plan to leave some time for you to ask questions also. Our goal is to have this last for an hour, hour and a half max. So by 8 o'clock, we should be out. And so, with that being said, we want to make sure that everyone gets a chance to be able to participate as much as possible. So, I would certainly just ask that everyone on both sides, both those who are asking questions and those who are giving the answers, consider brevity in order to allow everyone to be able to participate. With that being said, we're going to ask that you submit any questions that you have via the Q&A feature. So you should be able to find on your screen 3 dots. And if you click on those dots, it usually says more. If you click on those dots, it will then lead you to different features that are available within Zoom. One of those is Q&A. So you are welcome to use that to submit your questions. And we will be monitoring that throughout the forum in order to start asking those questions of our panelists. The chat feature will still be available, and you can use that for just general commentary. And if for whatever reason we're having trouble with the Q&A feature, then we will go to the chat feature to submit our questions, but we will announce that if that happens. So for now,